So today we're doing some dry needling, and I want to tell you a little bit about what it is. So dry needling is not brand new, it's been around for a while, but there's some emerging research coming out about it, and there's going to be more research coming out in the near future, and it's becoming much more common and practiced by physical therapists. What it is a form of intramuscular therapy where physical therapists and medical doctors use acupuncture needles to get into muscles that we can't get into with our hands. So we're trying to get into taut bands, trigger points, areas of muscle dysfunction, so that our other therapies, our other manual therapy, exercises, patient education then become more effective. Okay, we're going to give that a little bit of a twist to manipulate the needle. So really it's a form of a pain relief modality that therapists that have extra training can do when qualified. So although physical therapists use acupuncture needles for dry needling, it's not by definition acupuncture, whereas acupuncturists are using old traditional Eastern medicine philosophies with meridians and qi. We're using more of a Western medicine approach of therapists' knowledge of anatomy and physiology to get into certain muscular taut bands. So we're not looking specifically at going into channels in the body, but we're going specifically into bellies of muscles and tendons and sometimes around nerves. So all these needles are either going into muscles or tendons. These two are going into the same muscle. This is the muscle belly, this is the tendon. That's one of your rotator cuff muscles. This is another one of your rotator cuff muscles. And this is not, this is one of your scapular muscles. When I do the electrical stimulation, I want to see the muscle twitch because I'm trying to get rid of some muscle dysfunction. So in addition to the needle trying to relieve some of those trigger points and taut bands, the electrical stimulation going from one lead to the other then electrically activates the muscle to try to repair some of that muscle dysfunction. So after the needling session is done, it's not uncommon for a patient to tell me that they're sore the next day. Especially with the electrical stimulation, they can feel fatigued in those muscles, tired in those muscles as well. But many times after that second day, they start feeling a lot better. At least that's the hope or what we're trying to get at with the dry needling. One of the safety concerns is, if somebody's afraid of needles, I almost never needle, but just as a precaution anyway. First time I needle, no matter what body part it is, they're lying on their back or on their stomach because it's not uncommon to get a sympathetic response where you get a little flush or lightheaded. And that actually happened to me when it was being practiced on me. So it's just for the first time, at least for safety, we always do it lying down. So typically with dry needling, it's anywhere between 4 to 8 sessions. And in addition to the needling, we're still doing other things. The needling is in isolation. We're still trying to get at what caused the problem in the first place with exercise, other manual therapy, patient education.